Joining us today is Dr. Kei Ouchi. Dr. Ouchi is emergency medicine doctor at the Brigham and Women's Hospital. He also practices advanced care planning intervention for older patients with serious illnesses. Dr. Ouchi, thank you very much for your time today.
You're very welcome. Thank you for having me.
All right, so I'm going to jump right into the questions.
Yep.
The first question is, how is the ER like these days for you during COVID-19?
Yeah, so what happens is that usually we see probably around 170 to 250 patients per day coming into the emergency department at Brigham. And actually the number of people coming into the hospital have decreased since the COVID pandemic started. It's likely the reason, this is actually true for pretty much, like it's true in Japan, it's true here in other cities in the United States. And I think people are trying to stay away from the hospital. One, because they were asked to do so. And two, because they are, they don't want to overwhelm the hospitals and stuff like that. And three, because they don't want to get sick themselves. So that's why we think that the volume of patients who are coming in are low. So initially, we were geared up to try to accommodate a lot of surge of patients coming in. And the number of patients has actually not been that many. But the patients who are coming in are mostly all COVID patients, and they are quite ill. So I think it's just really hard times right now for everyone, both for patients and medical community. And yeah, so that's what's going on right now. Less number of patients. Patients for COVID are really sick. And we actually, I think yesterday or day before was the first day when number of ICU patients had decreased in Brigham. Until then, it was just kept on going up and up and up. So that's what's going on in emergency department. Just so you know, you probably know this, but the hospital has actually closed for all other medical treatments. No elective surgery, nothing. So the entire hospital is empty now to take care of emergency patients and with COVID patients. And I think there were up to 100 patients on ventilator in our hospital, which is unheard of. No one has ever seen that before, even in the size of a hospital like ours. So it's an unprecedented time.
Wow. I can't fathom that. That's wow. On the bright side, like we said, your number of ICU patients has decreased.
They have this thing called, we have codes in hospital, like code blue, like code red, like fire. And they made this new code called Code Hope. And when that's announced, people kind of gather in the entrance. There are no visitors allowed, so a family can't come in. But all the staff kind of go there and kind of congratulate the patient who is actually better and leaving. And some of these are, of course, definitive success stories, really life-saving. So at least there's some hope that some people are definitely getting better. So that's good. But it's still a very tough time for everyone. Yeah.
Wow. So we understand that COVID-19 is really dangerous to older individuals, but have you seen any serious cases that involve younger people?
Yeah, for sure. So that's why it's scary, because we usually, we see a ton of influenza patients every year, right? And then we know that some influenza patients can get real sick too. And young people can get real sick too, and they may die from this. Sometimes that happens. The frequency of that happening is just a lot higher than influenza. And it is scary to see people who are 30 and have no medical problems coming in very, very sick. And we do everything we can for every patient, but I think we try to do more for people who are younger and have no medical problems because, you know, you have decades to supposedly live. And that's why it's kind of hard. Staff seeing them and they're like younger than us, but they're super sick. And
Wow.
yeah, and some people die too. So
Oh.
yeah, for sure.
Yeah. As a doctor on the front line, what precautions do you think individuals, in particular teenagers, should take to avoid COVID-19 to minimize spreading the disease?
You should definitely do social distancing. You should wear a mask. So the recommendation regarding mask was really not sure before, and it's very difficult to prove something like that, where you're like, if you wear a mask, you will die less. You know, it's very difficult to do an experiment like that. But anecdotally, a lot of countries that wear masks all the time is doing better than the United States. And all these little things help, like washing hands and cleaning your surfaces and stuff like that, definitely help. And then you just have to sort of remind your own peers and your friends and family about how important this is, because America is really diverse, and some people really follow the rules and some people really don't believe in the rules.
Mm-hmm.
And if you have it inconsistent like that as a population, this is when people get sick, you know? So we think we got more sick partially because of that. You know, it has nothing to do with how good the medicine is. It's more about kind of the attitude of the country and how our cultures play a role in what we do every day. So I think it's really important to kind of continue to remind yourself about importance of those three things, as well as try to take care of yourself mentally by exercising and definitely seeing your friends and family on Zoom and things like that.
All right. So this is just a general question, but
Yeah.
what advice do you have for any young people that are interested in joining the public health field?
I think although this is a really tough time to think about public health, this is probably the time when you can see how important public health is. Actually, we feel it by skin, how important public health is, and how important it is to make sure that we invest people and money into making public health happen. Because literally, the changes in that are really having the changes in how many people are going to die in that country, you know? So I think it's really important time to kind of invest in public health, both people and money. So if you think you can make a difference, you probably can. And I would highly encourage more people to try to take those roles, because we really need that as a country. Yeah.
Oh, okay. Dr. Ouchi, thank you so much for joining us today. This is really informative. And also thank you so much for being on the front line and protecting all of us at home. Please stay safe.
All right. Thank you so much.
Bye.
Hope you stay safe too.
Thank you.